We're so honored today to have Dr. Poki'i Balaz with us. And it would take me a very long time to tell you everything that Dr. Balaz is and has been involved with. So I'll let her do that. But suffice it to say that she is extremely well versed in the world of senior care and especially dementia, and committed to transforming long-term care systems, as she says, through innovative solutions and culturally grounded policies. So she's not just involved in the medical aspect, she's also looking at it from a legislative point of view and a practical point of view. So Dr. Balaz, we're so glad that you could join us today, and I'm going to let you just take it away.
Well, thank you, Gary, and thank you for that introduction. And to let everybody on a little secret, I think Gary is way more well versed in many of these subjects than I am. But I love sharing space with him and learning from him too, as well as Leanne. So for all of those that I'm just meeting today, just hello and thank you for making the time to join. Is everybody joining a caregiver? No. So I see some people shaking their heads. Who's a family caregiver?
Well, I am.
Okay. And who's a professional caregiver? No. So a few family caregivers and everybody else is just support or tries or helps out. Nice. If you guys don't mind, because I love learning about who I'm talking with too, because it's not just learning, I learn from all of you too. If you don't mind putting in your organization, or if you're retired or just support into the chat, it's always great to know where everybody is coming from. And please jump in at any time. It's not really formal, and I don't even remember, Leanne, how much time I have. It's 30 minutes, I think.
Yeah.
But,
Take
all right.
what you need.
Much time as we need. Thank you.
No problem. It'll be quick and short. It's to the point. Sorry. Okay, let me share my screen, and then for everybody, just keep putting in the chat. I won't always be able to see it, but I will take a look. Also, okay. So, and 100% apologies as you can hear the bus pass us. Virtual is awesome, but where I live, my house faces the road, and it's wonderful to have this technology because I am caregiving right at this moment. My father's here with me as I'm doing this presentation. So just to give a real short onto what Gary said, I've been a caregiver to my father. He's in the end stage of Alzheimer's disease. I think it started about 18 years ago. My father's is in the end stages. Like I was saying, he's currently on hospice. And for his entire journey, we decided to care for him at home. And that was a personal choice, as every family makes their choice on what is best for them. I was away when I had helped get his formal diagnosis, which took us quite some time with his PCP. And then in 2012, my mother first called me to let me know that she was having a difficult time with my father and asked me if I would consider coming home to help her with caregiving. And I did, and I moved home. At that time, I was in LA at Cedars-Sinai. And so my background is I'm a geriatric doctor. I'm at Kukua Kalihi Valley. I'm part of the memory care clinic and the geriatric team. And then I'm also work for the Center for Innovation as a consultant on their global team. So the title I hold with them is the Director of Strategic Initiatives. And besides that, just a lot of community work and fascinating world that's opened up through policy. So this picture that starts off is with my family. I've been part of the Alzheimer's Association I think Ivy reminded me, her and I just made our 10-year mark. Ivy's the director of programs, and this was the walk during COVID. And so we were all dressed up and we were going to walk around my neighborhood. And so this was a lot of my first introduction to advocacy, came through the association. I started out just as a participant. Then I became a part of the support groups, and I started leading support groups, and I became the public advocacy chair, and then I became the board chair for the Hawaii chapter. I've since moved to the New York City chapter and I'm part of the PAT national team working to implement their new strategic strategy. Well, I gotta click, I think, to move it. Yep. Oh, too much. Sorry, everybody. I'm not used to this. So, advocacy usually starts off with the why. Right? A lot of people ask, why do you do what you do? Not just to me, but when we're in ledge season, when you're giving testimony, or when advocacy is getting together, the groups are meeting, everybody shares their why. And it's a pretty powerful tool, especially when you're doing policy work and you're meeting with legislators who are going to decide on the policy right on that macro level that is going to affect change for all of us in whatever part of the system that we play in. And I think for some, the why changes. And for me, it really started with the people in front of you. I know you can't see their faces, but that's my mom and dad spending their afternoon on the lanai. So we always make sure to bring my father out, and that's where it really starts from. I got into this because there wasn't a lot of talk about dementia and Alzheimer's back when my father was getting his diagnosis, or when the changes were happening. There wasn't all these support groups. It definitely wasn't virtual, and there wasn't all this NIH funding being poured in, and everything that's happening now, which is awesome and great, and I'm so happy it was. But at that time, there wasn't, and so my whole life changed. I planned to be a surgeon, and I went into geriatrics because while medicine taught me about the disease and what to expect, I had no idea what it meant to be a caregiver. And that was a totally 100% different journey than it was to be a provider. And so many times when I'm with patients, I have my provider hat on, but then I have my daughter or, just a caregiver hat on when I'm also trying to help navigate. There's two parts of me that are always kind of working together. And I've been a professional caregiver too. I've formerly was interim executive director of Luna Lila Home, so long-term care and adult daycare program. I've worked in the hospitals and as a student. So I guess there's a lot of different parts that I've been privileged to see caregiving from many different angles, and that has really helped to inform what I do. For me, I'm Native Hawaiian, and so it would not be how do I say this? For all of us, we present, right, the person who we come from, where we come from, the person that I do this for, or the reason why I got into this. So my father with the Christmas hat on, he's John Kelly He'enalu Okalani Balash, and the woman next to him is his mother, who I'm named after, like full name named after. So even though everyone calls me Poki'i, my real name is quite long. It's named after my grandmother, and they're from Puna. My mother's family is from Kauai in Wainiha. But we are also mixed, right? My mother's Portuguese, Chinese, my father is Czech and Irish. And so many things come from that. But from the Native Hawaiian perspective, right, elders have always been held in high esteem. And as someone named after my grandmother, it was within our culture that my grandmother took me in my formative years to do the intergenerational download so that I would learn about my culture from her up until she passed. And then I went back to my parents. And so I present them because I am who I am because of them. Everything I do is because of them, and I'm accumulative altogether because of those who came before me. So just giving them their due respect and some of the values that has informed me around policy. Just because I'm in the policy road doesn't mean that who I am ever leaves me. And so very much my cultures inform sometimes the way I'm processing, looking at things, and the way that I'm interacting with policy and making decisions. So for those who always ask, like, why should they advocate? Not an exhaustive list, and anybody please add to it if you want to, but there's a lot of empowerment in advocacy. You can definitely influence policy, raise awareness, training, education, promoting equity, right? We're going to talk about DEI, right? Diversity, equity, inclusion. And it's really the equity part that we're really trying to hone in on, right? Equality is one thing, being equal, but really pulling equity to the table and making sure that we all have the resources to be equal. So encourage systems change, right? Everybody on here has seen in history how things can change, not one part of the system or through the entire system. And so systems change. If you saw in the title slide, I didn't share about it, but I was part of President Obama has a scholars program out in New York City at Columbia University, and I was part of the 2023 cohort. I was also the first from Hawaii and the first Native Hawaiian to join their scholars program. And so while I wrote about cultural competency, as Gary did it in the introduction, we were also pushed to do system change. So my project at the end was to write a policy memo and explain and present how the entire aging system can be changed from the national level down to our local levels. And so it was a moving process to learn so much about what is happening on the national and across the states, the 50 states, and also to foster resilience and, of course, provide information and resource. So if any of you have other things you want to add in the chat, why to advocate, or you want to put in your why, that would be great. I always love hearing what others have to say. So caregiving advocacy, where that really centers around a lot of times the aging population, but definitely always make a point to say that not everybody who's caregiving is older. Well, it's very much that as soon as you think of caregiving, everybody thinks of a spouse, you know, caring for it, and usually a woman caring for their husband or something along those forms. But I started caregiving in my 20s, and before that, my mother and I took care of my grandmother, and I was only in elementary school, and so her grandmother, my great grandmother. So you know, caregiving starts from a young age, and there are so many caregivers in Hawaii right now who are in elementary or in intermediate, high school, college, early career, who are caregiving for their kupuna or for their family or friends or community, and they kind of get missed a lot. As well as when we talk about dementia, and a lot of times the picture that pops in is somebody who's older, right? And we have early onset dementia, and so a lot of times that doesn't get talked about. And we kind of, you know, steer towards this initial picture that pops into our head. But caregiving advocacy, what do I love about it? For me, along my journey, when you start honing in on like, what are my passions? The aging road, love it, period. But within that, really the Alzheimer's and dementia, as well as caregiving, because I'm a caregiver, and, you know, caregiver resources are not as robust as they could be. A lot has been done, and a lot still needs to be done, and that's why all of us are working together. But also relief for family caregivers. We're looking at also supporting improved health outcomes, economic benefits, right? Caregivers, especially family caregivers, are bearing the financial support right now across this nation. So we want to definitely develop policies that are going to assist in this and have the recognition of the profession for those in the direct care workforce of caregiving, and even for those who are family caregivers, right? That recognition of the profession really hasn't been heightened as it should be. And, you know, some of that has filtered into some of the issues that we're dealing with in our direct care workforce. We also, if none of you have looked up the RAISE Act, the report that went into Congress, and they just had the 2024 new report go in to talk about what has happened in the 2 years since the report was released. And so if nobody has ever taken a look at that, please look at the RAISE Act. It was submitted to Congress. It's full of wonderful information, and the new report has let them know what has happened in these past years and where the agencies are standing at and what has taken place. So this was in July when Governor Green signed, I think it was 14 or 16 bills for Keiki and Kupuna, among other things. And so we were so delighted to be there so that we could be part of the bill signing. One of the committees I sit on is Kupuna Caucus, and so many of us from there, as well as the association, Alzheimer's Association, and other groups joined into the bill signing. So some of the aging advocacy on the left-hand side talks about some of the reasons why to do aging advocacy, like ageism or awareness, social needs, social inclusion. Of course, equity comes up always as equity and access to really foster that independence and their right to determine what happens, you know, to themselves, to research the community and the intergenerational, which is one of the things I love. There's a lot of programs happening around the country right now where they're bringing, you know, like preschool and long-term care together, and many other modalities. And it's really great to see innovation happening around these spaces, and even in workforce. For those who have retired but want to remain part-time in the workforce, a lot of those initiatives are happening, and reports have been written on it. And so it's great to see a lot what's coming up. I'll share with you a little bit about my journey after, and just a little bit more about my caregiving and my dad. But as we keep going through, so one of the questions I was asked, I did not make an exhaustive list of what all passed in the last ledge session as we're gearing up right now. If anybody has ideas on what they would like to see, please submit. The Kapuna Caucus right now has just opened for anybody to submit their ideas for the next ledge season, so that we can put our package, our caucus package together that we will be supporting. It is limited to 10, so please, if anybody has ideas, Kapuna Caucus happens every first Friday of the month from 2 to 3. Everything is recorded. You can watch past ones on YouTube. So if anybody has an idea. But this was one, that picture that you saw, this was one of those that was signed into law by the governor, so the Comprehensive Long-Term Care Act. And I won't read, and I know, on PowerPoint, you're not supposed to put heavy words like this, but I just copy and pasted from so that everybody could just read the real quick synapse on it. But it's really to look at long-term policy goals, right, to ensure the availability of a full continuum of institutional and community-based services for Hawaii's growing elderly population in Hawaii with disabilities and chronic conditions. So aging in place, HCBS services, home and community-based services, is really ramping up right now at the national level and the state levels, as many people want to age in place and stay at home. And so now how do we bring those support systems to the people who need it, who want it and need it the most? Another area that gets missed a lot is the IDD community. So besides my father, I have my nephew who's autistic. And so those two worlds for me converge. And a lot of times the Alzheimer's Association and Developmental Disability Council, the state of Hawaii, band together when we're going to the ledge to when we're going to testify or support legislation. And that's really important because I find that sometimes when I'm talking with people about aging, they think of aging only, but people with physical and developmental and intellectual disabilities will age also. And so they need just as much support services in the aging world as those without physical, intellectual, and developmental disabilities. And so sometimes they get missed. And so we're really happy that we're bridging together. There's a grant in Hawaii called Bridging IDD and Dementia. It's also across many states, and we just had in July our meeting in DC to really talk about how to bring these support services together. I should not use don't use the mouse. And then one of the biggest things, right, that we were really excited about was when we passed the Silver Alert program in Hawaii. Right, this was, I think, about the third time that we had introduced this to the ledge, and it finally passed, and we had a huge celebration. And the Silver Alert, basically in a nutshell, is similar to the Amber Alert. And I think many of you have seen the news where people with dementia have gone missing on the news. And so we were super excited to pass the Silver Alert. And so it's going to be, we're just excited. So we have the Amber Alert, and then we'll have the Silver Alert, and really hopefully we hope that this will help, to bring people home safe and earlier. Another thing that Senator Moriwaki convened was a long-term care workforce. And so many of us were pulled together to begin to look at our aging systems in Hawaii. And so there are there's a steering committee I sit on, and then I head the quality of care committee. And there were other 4 also some subcommittees: workforce, finance, long-term care services, and supports. And so please let me know if anybody or the organization is interested. We have already hosted earlier this year, was it April, a 2-day conference where many stakeholders came together to hear about the intent and about the subcommittees, and to give their feedback on what they would like to see regarding population health, HCB services, and many other things that are happening throughout Hawaii. And so it was very exciting. And as the ledge season is coming back, we are all reconvening to move forward. The Hawaii Dementia Initiative, I forgot my picture, but Hawaii Dementia Initiative is another great initiative that's happening in Hawaii right now. And those are the 7 committees, that HDI has right now. And so anybody can join. If anybody wants to join, please let me know. If you want to be part of these subcommittees, we have been meeting for quite some time now, and just launched a public health campaign. So there's a lot of PSAs that have gone out. think the second one will be released, and I was super excited because I got to be part of the PCA and do one of the talks for elder abuse with the news station. So again, there's many things that are happening in Hawaii as we're trying to surround around policy. And these are some of the national initiative levels. National seems so far away, but many of these are filtering down to the state level. Things like the BOLD Infrastructure Act, right? CDC BOLD. Hawaii is part of CDC BOLD. We are in phase 2. We're also part of the CDC BOLD Healthy Brain Initiative and the HBI initiative. We are creating the first Native Hawaiian roadmap. Right? The Native American Indian roadmap has been created, and so I am part of the implementation team that is putting together the Native Hawaiian roadmap. And so we've just finished going to most of the islands. We still have Big Island left, and beginning to put together that report. The guide is here also. HPH is part of the guide that came from CNS looking at payment improvement for dementia. We were the first in the entire nation to come up with the Kupuna Caregiver Program. And so that really put Hawaii on the map as many looked to see how they could develop a program to help caregivers continue to go to work. And so Hawaii was very proud that they were one of the first to bring that to the table and have it passed among the 50 states. Many of these other ones are things that have happened in the past. And of course, some of these are geared towards the Alzheimer's Association, but of course, come down to the state level. One of my passion projects right now that I'm working on is the financial health of caregivers, or caregiver financial viability. And I wrote a policy memo for this when I was at the Obama Foundation, giving recommendations on how we can improve caregiver financial health. And so these are not numbers for Hawaii. We'll look at numbers for dementia in Hawaii in just a bit, but right, 53 million caregivers, 18 million with dementia, out-of-pocket costs varying $7,000 to $12,000 a month, over $300,000 per year is what caregivers are bearing after Medicare has come in or CMS has come in to paid. I really have a spot to work with employers so they can understand how to utilize their caregiver workforce to the best of their ability, especially family caregivers. Excuse me, because I was a caregiver and I had challenges at work. And then when I became the person who was now hiring, I wanted to make sure that caregivers felt that they could have a place where they would feel that they could work and feel safe, and and have a place, because many caregivers are trying to choose between paying bills, right, or buying supplies. Some are not able to take promotions, some are decreasing their work week, some are increasing. Some of the reports are showing that they don't feel valued at work, and so they're not always feel that they have the voice to speak up, to say they are a caregiver and the help that they need. So a lot of training, education, and a lot of the leadership needs to buy in to help support this as it filters down. And so the expansion of services, employment, and direct care workforce. So we will be hosting a caregiver luncheon for employers and HR to come together to hear what's happening in Hawaii, as well as what is happening outside of Hawaii, and then how we can all come together to support our working caregivers. So in Hawaii, we have about 29,000, really, we're already closer to 2025. So we're hitting the 35,000 mark of those living with Alzheimer's in Hawaii. We know that it's underrepresented, right? Many don't report that they have Alzheimer's, and that can also be the different subpopulations, Native Hawaiian population, which has shown to have a 60% increase for all dementia and other related Alzheimer's and other related dementias, as well as many of our other subpopulations within Hawaii. We have over 60,000 caregivers, like 66,000, another number that's underrepresented, putting over many hours of unpaid care. And the value of the care is just superseding and growing. And so that's when we're looking at that, right? These are unpaid hours that caregivers are working at home, that we're all working at home, right? My job doesn't stop. There's no clock out time when you're a caregiver. It is a 24/7 forever job. Even if your person is in a facility being cared for, you're still caregiving, you're still caring for them from afar, or like when I left Hawaii for some time. And so how do we then bring the services and supports, especially the financial resources? It hits, right? There's the emotional toll and the physical toll. as dementia and Alzheimer's progresses, and you have to help out more as a caregiver. And then there's the financial toll that comes in. And that is a part that, in my opinion, needs a little bit more robust and a little bit more attention so that we can support our caregivers. So some of the aging in place challenges that we're looking at, right, is technology and independence. One of the things that was presented to us at the long-term care workforce in Kupuna Caucus was a greenhouse project. And I was a consultant for CFI, or Center for Innovation. And so really looking at that small household model, right, that started 20 years ago and has spread across the states. They're international now, but it's a different way of taking a look at not changing the way of looking at long-term care. So instead of having those large 500-bed facilities, we're really building the small homes that look like a home, feel like a home, where there's no nurses stations, there's nobody in scrubs, where the universal workers who are in there are like part of the family. Everybody has their own bedroom. Everybody has access to outside. They cook, they eat together. Everything they need is in the home. And so it looks like a home, feels like a home. Of course, there's modifications made as needed, but it is centered to foster that independence and to provide a familiar space, and not that facility, I guess, that many don't want when they're looking at where they're going to be aging in place. And so a little bit about my journey. That's me. This is when I was working in Lunalilo home. I think it was 3 a.m. I came home, and because a lot of times I'd have to go to work, then I have to come home to change him or feed him and go back to work, and then come back and go back. So a lot of work got done late at night. And so he was up, and like many of us, sometimes just can't sleep. And so I hung out with him, and I just gave him his snack. I think I was giving him pudding at that time. And so my journey has really centered around family, and then becoming a daughter and getting into the community and learning about caregiving. Then I became a clinician, and many of those things that you see on there has been part of the journey that I didn't think would come out of going into medicine or starting to work in policy. And so, it's just been a privilege to see it. It's been a privilege to care for him. And many people have asked me, would you do it again? And I said, yes, in a heartbeat. With all the challenges that came through, I would definitely do it in a heartbeat, because as much as we talk about the challenges, we need to always talk about the good that comes with it too. It's not all bad caregiving, nor is dementia. There's a lot of life left in them. There's a lot of good moments. There's a lot of times to still smile and laugh and bond. And he can't talk, but he smiles. He still makes faces, when he's annoyed, he's irritated, when I've been dancing too much in front of him, and he's like, oh goodness, please, I need a break. And then there's some moments where I put on his music that he used to like, and he starts tapping his finger or moving his foot side to side. And those are the great moments. And yes, I'm tired, and I've been burnt out more than once, and I've had moments where it's hard to crawl out of bed and to make appointments, but there's nothing like it when I come down and he has a smile on his face. It washes it all away. So I wouldn't change it for anything. It's what's made me. It's what's made my career. It's who I am. It's everything that I do, the reasons why I do what I do. These are some of the awesome initiatives that I got to work on. And, a lot of this just comes, from lived experiences. These are some of the committees that I get to be on. I didn't write all of them out. Some of them are local, and then some of them are national. So like the Moving Forward Coalition is a national one that's looking at many aspects of aging and long-term care. And they have many committees. I sit on the Household Model Committee. So again, looking at the physical environments and how we can change that. IE Squared is looking at the indigenous perspective of Alzheimer's and dementia. The Center for Health Policy, I sit with them, and UCSF CARE. But down here locally with PABIA, SHIPTA, the Alzheimer's Association is on there. And of course, I am on their purpose, so I could just say it, but of course the Caregiver Foundation, which all of you are part of, and I've definitely had the privilege of being a part of in many different ways, and it's always exciting to be here. So where it led me though, because the original title was going to be and beyond. And so one thing that I didn't ever think it would take me was outside of Hawaii. And so when I wrote to apply to this program, I wrote about caregiving and cultural relevance within aging and caregiving spaces. And that took me to New York City, to the Obama Foundation Scholars Program, which I have shared. I was the first from Hawaii, or I still am the only from Hawaii, and the only Native Hawaiian to have joined the Scholars Program and really get immersed into systems and design thinking. So this is a global program. There's everybody sitting there is all from a different country. Only the person next to me in the blue tie, he's DACA, so he represented Mexico and America, but everybody else. And so I got to learn about aging through all of from their countries and their perspectives. And many of us, like Sola, who is in Nigeria, he and I have presented together and linked up together to do global initiatives together. And many of the ones sitting there, we have linked up to look at how aging can improve quality across the globe. And then currently, in just 1 week and 1 day, 8 days from now, I'll be leaving Hawaii again, as I joined the Health and Policy Fellowship in DC. And so I'll be moving to DC to work on the Hill for a year. And again, I get to share space as being the first from Hawaii and the first Native Hawaiian to join them in their 16 years. And I don't share this for taps on the shoulder, but just acknowledging that there's still a lot of spaces for us to be the first, and spaces for us to come as a Native Hawaiian, but as somebody from Hawaii, and for Hawaii to be able to come to the table and share what we're doing and all the great things that are happening here, and then to learn from everybody across the world and across the nation. So if you want to get involved, there are many ways to get involved, right? Through education trainings, calling Gary, calling Leanne. They'll definitely get you involved wherever you need to be. Social media, you can do it with an organization, you can volunteer, you can do it on your own, you can just share your stories, however you want to do it. Here are some of the wonderful organizations that are around Hawaii that can help. This is not an exclusive, all-inclusive list. There's definitely more to add here. And then if you want to reach me, that's my email. Just use the Gmail one from now on. I should do the Columbia, but you can definitely reach me if you have any questions or ever want to talk about things. Other things that I do are like the Dementia Basics and the Caregiving 101. I'm a Savvy Caregiver trainer and a Rosalind Carter Institute, the Dealing with Dementia trainer also, and they're both wonderful and fabulous programs. That's really what helped me to be successful at caregiving. And so, yeah, that's about it for policy. And if anybody has questions or about policy, Alzheimer's, dementia, caregiving, I'd be happy to share. Thank you, everyone.
Thank you so much. This has been really, really great.
Thank you.